I think that the biggest problems we sought out to solve were as a busy adult, it is very difficult to go to multiple places and to coordinate all the different care that you were getting, right? I would argue that just frankly, the time you spent driving to a physician's office, waiting in a physician's office, speaking to them, and granted, right, when you speak to them, these are 3 or 4 minute conversations. You're out the door. You've got to go give your blood somewhere else. You're waiting for that result to come back because the doctor wants to get reimbursed more. You're going back to the office to have that consult. If you're going to a specialist, you're then getting a specialist recommendation. You're then waiting 2 or 3 weeks, maybe a month for a specialist appointment if they're even taking new people, and you got to get there right. The whole cycle repeats itself. And the reality is, the moment the primary care physician lets you go, you're done, right? And so if you were to call your primary care physician and say, I have a question, they'd be like, I just saw 300 patients today. Like, what am I supposed to do? 300 is being crazy. Like, realistically, like, I saw 150 patients. Like, I sort of kind of remember you. And I would argue, right, the healthcare system, when you are generally with your practitioner because they care, they're generally very good moments. But it's getting to those moments that take a lot of time that are difficult. And the other thing, the conclusion I've come to is where healthcare breaks down is in the transition from provider to provider and the way information gets passed on in a way that is quick for the other person to consume, digest, and then do something useful with. And so what we really sought out is we said we want it to be the most inconvenient experience so you can do it while you're in the comfort of your home. You don't have to go into a physician's office. And we actually openly acknowledge that in order to change the care model to the way that we want it to eventually become, you've got to take physicians that understand hormones, let them initially give their 10 or 15-minute consults, watch what they're doing and say, no, we want you to insert this next piece of information. We want you to bring in this next question. We want you to change the experience this way a little bit. And I'm very lucky because the team I have, my co-founders are all kind of like, I'll say, have scaled companies, very large, all have healthcare experience, care deeply about it, and we're all consumers ourselves of it. And so a large part of what you're going to see, or you're going to see how you're going to see the company evolve is, right, we just started adding longevity medications, which most physicians don't know how to prescribe. We're focusing primarily on how do we give you more energy, right? So you can do something useful with it. And the next kind of bolt on is people think that testosterone is a very easy and linear therapeutic category to treat, right? I go get my blood test, I get my meds, I get my next blood test. It is arguably the single most difficult telehealth business to build, bar none. I know them all inside and out, and it's because of the at-home testing component, making sure you get the patient to be compliant, sending controlled medications, titrating every 90 days. It is an absolute mess that we've spent $2 million building a custom EMR just to make sure we can handle patients. Now, the beauty of it is, once you spend 2 years going through the difficult process of figuring out all the paper cuts of the business and fixing them with a technological solution, you then say, okay, what's the next therapeutic category that's really hard, and how do we combine them? And so the next one we'll go after is thyroid, right? Another 8 biomarkers. Then it is medically assisted weight loss. And so, really, the way healthcare should look is, Daniel, you come in as a patient, right? You're not a medical professional. We can't expect you to be. All you can tell us is, tell me how you're not feeling good. Well, I'm feeling tired. I'm feeling like I'm a little bit depressed. Maybe I've got a BMI that's 3 points higher than it should be. I'm carrying some fat around my waist. And it should be our job to say, okay, normally you'd have to go to 6 different specialists to go treat those problems. Don't worry about it. Let us collect all your biomarkers and let us make sure that we have the internal expertise to understand all the nuances of those biomarkers. And then let's put together a program that is sequential in nature, which slowly pulls off each of the symptoms in a way that provides you with the least amount of treatment necessary, versus you going to this doctor and this doctor and this doctor and this doctor and getting 4 or 5 different medications. And that's really the way we're beginning to move, because at the end of the day, our goal is to get you symptom relief as fast as possible so you can just get on with your damn life.